Welcome, everyone. Thank you for attending our webinar about how to host a legislative meeting, particularly around Medicare Part D and the 6 protected classes of medication. If you've received the link to this webinar, that means that you have expressed an interest and a willingness to take your advocacy to the next level. So thank you for that. We'll begin with a brief overview of advocacy. Then we'll talk about our particular issue that we're hosting meetings around, and then we'll move into how to host a legislative meeting. So advocacy can take many forms, and the simplest of which is self-advocacy, the idea that your rights have been infringed upon by somebody or some group, and standing up and speaking up for yourself. At a more collective level, the Depression and Bipolar Support Alliance is engaged in regulatory and legislative advocacy. Regulatory refers to the executive branch of government. These are agencies that are responsible for enforcing rules and laws, and legislative refers to Congress, senators and representatives who create new laws that affect people. And our issues center around access to quality mental health care and access to medical products, which includes medication, which includes the 6 protected classes under Medicare Part D. With regard to this particular training and these meetings, the regulatory agency that runs Medicare is proposing changes that would restrict access to the 6 protected classes of medication. And our goal is to target Congress and ask them to intervene and prevent those changes from taking effect. The 6 protected classes of medication are medications that everybody who is on Medicare are required to have unfettered access to, and that includes antidepressants and antipsychotics. And among the proposed changes is requiring prior authorization for refills of prescriptions. Now, in order to get a prescription in the first place, your doctor can be required to fill out a form in order to get authorization from Medicare to for them to pay for your medication. But we believe that asking for that after the fact, when you have when it's time to get a refill, can create a barrier that having to schedule an appointment to see your doctor and also pay for that appointment, and then if you don't have the opportunity to get in to see your doctor, there's a potential for a lag and a lapse in your medication, that if you run out of your medication and are not able to get your refill in time. The second proposed change is called step therapy, the idea that you would be required to try a lower cost or possibly generic medication and see if that works for you before you would step up to the medication that you and your doctor have agreed is the best possible treatment for you. Now, we commonly refer to this as fail first, the idea being that you would be required to try the lower cost medication, and only if it fails would you be allowed to receive coverage for the originally requested medication. Now, unfortunately, when we're talking about antipsychotic medication and antidepressants, having a medication that doesn't work and that fails for you can be catastrophic. And then our third point is that these barriers would prevent people from having access to new innovations in medication. Unfortunately, 1/3 of people living with mood disorders never find a medication regimen that works for them. And there's constant research and innovation into new medications and new applications, and some examples of that would be long-acting injectable medication or medications that have been modified to reduce unwanted negative side effects. But unfortunately, if you don't have coverage from your insurer, then you would not have access to those new innovations in medication. So now I'd like to talk about how to host a legislative meeting. And there's a few key points that we want to make about what you want to say when you sit down with these legislators. They're very busy people, and we want to make the most of our time with them. And the first point is to know your audience, know what is important to them and how to say what you want to say and make it resonate with them. And the second is that you need to put your own personal story into your message, but you don't just want to sit down and tell them your life story. You want to relate your experiences to the issue that you're talking about and how they can, what you would like them to do in order to improve the lives of people living with mood disorders. So a good way to do that is to write down what you have to say and practice how you want to say it. And this can help you keep the message short and stay on point with what you want to say. Do your research before you sit down with them. Make sure that the facts that you're telling them are true. And then you want to leave them at the end with a very clear ask of what it is that you want them to do. In this case, as I mentioned, the agency that runs Medicare is proposing changes, and we're asking senators and representatives to oppose those changes, to create rules and prevent these changes from taking effect. So, as I mentioned, we'll be meeting with key senators and representatives. And these are people who have been identified based on their advocacy on behalf of people living with mood disorders and other mental health conditions in the past. So it's important to begin with, again, doing your research, finding out what it is that they have done, and beginning with thanking them for their efforts. You always want to make someone feel good about themselves when you're about to ask them to do something for you. And then also present your issue clearly, and you want to bring takeaways and fact sheets that you can leave behind with them so that they'll remember what it is that you had to say to them. And again, in this case, DBSA has created a one-page fact sheet that we will be providing you with. So when you're telling your story, you want to narrow down your experiences to how they relate to this particular issue. And again, we're talking about access to antipsychotic medication and antidepressants. Do you have an experience with either of those? do you have an experience with a lack of access, and what happened to you or what would happen to you if you didn't have unfettered access to those medications? So our goal is to educate those key members of Congress on the impact of removing unfettered access to the medication. It's also critical that you share your perspective, your own personal story around this, but again, keeping it succinct and keeping it on point and on message. So to help you with that, we've developed a few talking points to help you tell your story. And our first message, overarching message, is that 2/3 of people that are trying medication end up having to try multiple medications before they find the medication that works for them. And many of those people actually have to combine 2 or more medications in order to find relief. Now, that process is very long, and it costs them a lot of money. And to ask them to switch medications all of a sudden throws them back into that process. And we don't believe that's fair, especially at a point in time when people are the most financially vulnerable. Now, we also believe that people can and do live productive and thriving lives while living with mood disorders and other mental health conditions. And then, again, as I referenced earlier, the 1/3 of people who never find relief and may never find it if they are not given access to new innovations. So how can your story be connected? How can you relate to what our overarching messages are? We'd ask that you would briefly share some of the challenges that you faced, and I emphasize the word briefly, and then share about what it is that you do in order to sustain wellness in your life. Is medication a part of that? If so, how big of a part of your overall wellness, recovery, and action plan is that? And then share about the experience of feeling well, and then we ask that you would share what a lack of access to medication would mean for you. So to help you with this, there's a little exercise that we would ask you to do, and that's to produce a 6-word reason for why you're engaging in advocacy. Now, this is a reason and not a goal. This would be something along the lines of, I've seen too many hungry children, and not, I want to end world hunger. This could be 1 6-word phrase or 2 3-word phrases, but the goal is to help you think about why it is that you want to share your story and help you to begin to boil that down and make it more succinct. So other examples would be, an art mentor changed my life. Or an example of the 2 3-word phrases, I was deaf, now I hear. Your reason might capture one moment that drove you to be an advocate, or an entire lifetime, or a core belief. Write as many of the reasons as you would like, and you'll be able to draw from that and sort through those. When you tell a personal story, you tell it for a variety of reasons. When you speak as an advocate, your reason needs to be clear so that your audience understands why they should consider your goals and mission. Advocacy stories are focused and determined by explicit goals for a particular audience with specific messages. It's important to keep in mind your audience and why your experience is important to them. For the upcoming town hall and legislative meetings, your audience will be members of Congress. The reason they're attending is to hear from you, the peer, about what access or a lack thereof would mean to you. Referring to the DBSA list of messages listed previously in this webinar, identify which messages you think your story will reveal. Your story will not reflect all of the messages, but the ones that are most relevant to your story. So I mentioned before that the first thing you want to do is begin with a thank you. Again, we want to make people feel good about themselves before we ask them to do something for us. And we also want to include a statement of hope, an opportunity for a brighter future. Share about how access to the 6 protected classes has helped us, and then go into what could be the negative connotations of a change in that policy. And then, as I mentioned before, you want to end with a very clear ask. And in our case, that ask is that we're asking Congress to intervene and prevent the changes that are being proposed in Medicare to access to the 6 protected classes of medication. So what are our next steps? Thank you for watching this webinar. First of all, thank you for expressing an interest in taking your advocacy to the next level. Once you've had the opportunity to watch this webinar, DBSA will follow up with a phone call, and then you'll receive the fact sheets that I referenced, the leave behind one page to help the person you're meeting with remember what it is that you had to say. And then we will schedule legislative meetings. We're planning to schedule meetings in Indianapolis with the senator there, as well as both senators in Ohio and Cleveland. And I know that we have some other advocates who have expressed an interest. We have partner organizations that have scheduled meetings that we can connect you with so that you can attend. Thank you again.